Hello, it's Dr. Lisbeth Alter. Are you currently on antibiotics? I don't think that as a society we understand the repercussions of antibiotics. Most patients think, well, I'm sick, I don't have time to be sick, I need to get these antibiotics, and sometimes to the point that they know now that most doctors don't give antibiotics if it's just been a few days of symptoms. So they'll add a few more days to their story just to make sure that they are prescribed the antibiotics. And I understand the inconvenience of being sick, but I'm here to explain the repercussions of antibiotics. And I know I've heard in some of my lectures it being said that once a patient takes antibiotics, it takes about 2 years to restore fully, not partially, but fully, that original microbiome that was there prior to the course of antibiotics. And this varies from the type of antibiotic that you get. So, most of the time, things like amoxicillin, these kinds of things are not benign, but they're not as heavy duty as others. And definitely when patients, need intravenous or in the vein, antibiotics in the vein, or if they're in the setting of intensive care units where sometimes they'll get a PICC line, which is a permanent catheter in the vein to deliver more days of the antibiotic. Now, if you are currently on antibiotics, I'm by no means telling you to get off of them, but I am today wanting to encourage you to increase your interval between the time of your last antibiotic course and your future one. So many patients also tell me, oh, once or twice a year, I always get sick and I always need antibiotics. Well, just because this has been your pattern doesn't mean it needs to be your pattern moving forward. So if there's ways of polishing your immune system to help increase your interval. So I'm not saying if you were doing antibiotics twice a year that next time is going to be 4 years, but just working on a few months of an increase of the interval. So let's say it had been 6 months since your last antibiotics, working on it being 8 months. And I always remind patients that before antibiotics were invented, people survived infections. Our bodies are equipped to fight infection. That's why we have fever. That's why we have white blood cells. There's a sense that we've dismissed the body's ability to fight infection. But obviously in the wear and tear and stress of our society and lack of good nutrition, we need extra help, and that's where supplements play a role. And I've often spoken about vitamin C, D3, probiotics, Mycodefense, which is our mushroom formula, Viradefense, which is andrographis. If you're someone who gets UTIs frequently, there are many urinary tract formulations like our UT Shield. I will include these names in the description summary so that you can explore them. But there are ways of avoiding whether it's cellulitis that you have all the time, which is a soft tissue infection, or urinary tract infections, sinusitis, whatever it is that your issue is. There is a way to help your immune system and increase your interval before your next course of antibiotics. Well, I hope this helps, and have a healthy day.